and I do know that it gives concern to Montanans all across the state as well. Today, as Montanans, we received some of the most solemn news that we've received over the past few months. We know of 58 positive cases at the Canyon Creek Assisted Living Facility in Billings. Certainly appreciative of Riverstone Health for stepping up to prevent further cross-contamination and make sure that proper PPE is being used. But I join Montanans in being concerned about the situation. And it's clear that more needs to be done to protect residents, not just in our nursing homes, but also in our assisted living facilities as well. So I've already asked the Department of Public Health and Human Services to issue an emergency rule to require that both long-term care facilities and assisted living facilities participate in surveillance testing of staff and residents as a continuation or a condition of visitation. And I'm doing it by emergency rule because it allows for stronger enforcement by the department. Look, 67 of 72 long-term care facilities in Montana are already participating in sentinel testing and are setting up plans to conduct weekly testing of staff. There are 5 long-term care facilities in our state that have been unwilling to participate in testing, and it's unacceptable. And with this emergency rule, if they want to continue to allow visitors for the residents, they'll now be required to do that testing. 177 of 217 assisted living facilities in our state are participating in the sentinel testing, with 107 facilities completed so far. Canyon Creek could decline participation when we encourage sentinel testing. Every single assisted living facility should be conducting sentinel testing. So the purpose of this rule is to help prevent what's happened at Canyon Creek moving forward. With guaranteeing that testing is being conducted on a regular basis, we can ensure that any evidence of the virus in a facility is caught early on and mitigated before it spreads further. In March, we made a series of decisions to help prevent significant outbreaks in our state and give us time to ramp up preparedness and response, much like just about every other state in the nation did. And while under the stay-at-home order, we were able to learn more about COVID-19 and its potential impacts on our communities. We were able to get more supplies and resources. Our healthcare systems, too, were able to learn more and build up their resources. But so much more so than the actions that I took, it was Montanans all across our state who stepped up, who understood that their individual responsibility in protecting our neighbors during these challenges, and they made sacrifices knowing that we had to do our part to keep each other safe. And that brings us to why we're here today. Rapid active contact tracing, which is really a cornerstone of infectious disease prevention. It's happening with quick identification of exposed contacts, those infected with COVID-19. Our local public health partners are working incredibly hard to get those individuals at risk of causing the continued spread of the virus into quarantine or isolation, thereby preventing disease spread. Tests are in much greater supply, and we have robust testing efforts underway in Montana. Everyone who is symptomatic is to get tested. Additionally, close contacts to a known case are being tested, and we're learning of new asymptomatic cases or cases without symptoms as a result of that. We're also conducting sentinel testing among those living in high-risk settings, such as nursing homes, assisted living facilities, correctional facilities, as well as on our tribal communities. Pleased to announce, we've been working on ramping up our tests. Pleased to announce that last week from June 27th to July 3rd, we met that testing goal of 15,000 tests per week. For the first time, we actually surpassed it. Performed a total of 17,913 tests. We continue to stand up community snapshot testing events for anyone who wants one, free of cost. List of all the upcoming test events can be found at covid19.mt.gov. While we continue to build up our stock on hand of personal protective equipment that we can then turn around and provide to healthcare facilities, counties, and tribes, I know that healthcare systems across the state are also building up their supply as well. We've put in place what we need to manage the virus at its current levels. While much has changed since March, when we first put forth together as Montanans prevention efforts to keep folks safe and healthy and to save lives, we're still asking much of our fellow Montanans. That much of the same that we're still asking includes maintaining social distancing and good hygiene, like routinely washing your hands. We continue to see that large events, especially with those you don't typically interact with, are a factor in contributing to new cases. We need to make a habit of these actions in this new phase in order to minimize our risk as we continue to live our lives with COVID-19. We need to have a healthy workforce and a public that feels safe and is safe for our economy to do well and for us to be successful under phase 2 of the reopening. And we also have to make mask wearing a habit. We're asking this of Montanans in phase 2 because it's an effective and easy way to protect your loved ones and your neighbors from COVID-19. And I do have optimism that Montanans will spread the word and share with their neighbors the importance of wearing a mask when indoors or in crowds. Wearing a mask is really about promoting respect and kindness for others to save lives and get through this together. That's just part of what it means to be a Montanan. But don't just take it from me. I was joking that it feels like a signing table, but I know I'll never get there. Today, I'm joined by Coach Choate of MSU Bobcats football team. You'll soon start seeing both on statewide media and through social media a PSA featuring the coaches on the importance of Montanans masking up. And while one of the oldest rivalries in college football may still divide Montana, I think we can all agree that we'd like to see the Brawl of the Wild take place this year. And most importantly, whether you're a Grizz or Cat, we can all agree that we want to keep Montanans safe and healthy, and we want to stay open. So we'll show the PSA, and then I'll turn it over to Coach Choate.
Montana's fighting COVID-19, and if we want to stay open, we should all listen to the experts and mask up, especially when we can't social distance.
We want our students in class and sports back this fall, but we've got work to do. One proven path to slow COVID-19 is to mask up.
We're wearing our masks,
and our players are too.
I'm wearing my mask to protect you.
Will you wear yours to protect me? Mask up, Montana.
Thanks so much, Coach.
Oh, so it's a pleasure to be here. I think you hit the nail on the head, Governor, when you talked about that. This is something that really should unite our state and not divide it. And I think that it doesn't matter if you wear the blue and gold or you wear the maroon and silver. This is an issue that really we all need to get behind. I know our boys and our fans want to get out to Bobcat Stadium, and I know Coach Houck and his team feels the same way. And that's just one example of us working together to take some pressure off our healthcare workers and to mitigate this virus. We know, quite honestly, we know that, hey, this is an airborne virus, and we're not going to, when we get the vaccine and some of those things happen, we'll have better answers. But this is a very simple way for us to do our part. I see this as an act of patriotism in a lot of ways and pride in our state. And I'm looking forward to seeing all of our fellow Bobcats and Grizzlies around the state to participate in the Mask Up Montana campaign.
Great. I really appreciate it, Coach. And in addition to the coaches, we're seeing businesses also standing up saying that they're going to be masking up both their frontline workers and others, encouraging others to wear them. And really appreciate your leadership and your efforts, Coach. And with that, if there are any questions for me or the coach, #5. Oh, you just raise your hand since we're on Zoom. Raise your hand and we'll call on you.
Oh,
Holly,
hey, this is Holly. Can you hear me?
Holly, can I wish you a happy birthday?
Oh, thank you. Appreciate that. So I have two questions for you. One is that you said we need to be working on building habits to be successful in phase 2 of reopening. I'm wondering, what do you think right now at this point? Have we been successful in this phase, and what is successful? How do you define that? And then the next one I wanted to ask is just how capacity for contact tracing in the state is looking. Lewis and Clark County today updated some of its guidelines for gatherings and said, large gatherings would really stress its ability to do contact tracing here. So kind of wanted to get a picture statewide of how that capacity looks right now.
Sure. So for the first question, as far as how are we doing in phase 2, look, we knew that we would see an increase in cases when we opened up. Make no mistake about that. And I think even as we were going into that on around the 1st of June that I said that. But when you look at 6 different weddings over the last couple of weeks that were the cause, and not necessarily the ceremony, but the activities before and after, that were the cause of multiple cases in multiple counties. When you look at, we know that we're not all taking the steps that we should in larger gatherings. When you look at what happened in Yellowstone County with the memory care facility, those are all, to a degree, preventable cases where if Montanans continue to take this seriously as they have in the past, knowing that, look, I'm fatigued, I'm tired. I know Montanans are tired of 4 months of COVID-19, but we can't let that fatigue allow us to let our guard down. So the encouragement is to continue to take it seriously. Know that we need to be taking the steps. So certainly that we're not taking steps back, but more than that, and more than just about taking steps back, it's to keep community members safe and healthy and figure out how we can minimize and mitigate the spread. The spread is greater than what I would want to see, certainly. I would say in part, and that feeds into your second question, when it comes to contact tracing capacity, one thing that really has changed, even over the last handful of weeks, where we used to just test individuals that were, once we found a known positive, we test individuals around them that were symptomatic. Now we're testing everybody. And that does add to the efforts of contact tracers. We at the state level have actually, when the Crow and Bighorn County had asked for some assistance, so we provided some individuals to help with contact tracing. That we've trained most of our National Guard soldiers and airmen now so that they can assist as well. So we're staying in close contact with local public health, and if additional needs arise for contact tracers, we'll work with them to get the resources that they need.
She had a follow-up to that.
She had a follow-up? Okay. It's her birthday.
She gets a follow-up.
Yeah. Holly, you had a follow-up.
Hey, I am wondering, sort of just on the first question I asked, would you deem phase 2, I don't know if success is the right word, but has it gone as you expected? Has the case growth we've seen lately been worse than you had predicted, I guess? Because I know you've said all along we were going to add cases, but I think the pace at which we're seeing is kind of something that is taking a lot of Montanans, are worrying people quite a bit just with how rapidly it's growing.
Yeah. And I'm concerned about that as well. Look, when you have multiple days where there were literally 0 cases, on the one hand, any increase would be concerning. But the numbers that we're seeing, to me, are very good. Still recognizing that, yes, we have the lowest per capita positives, hospitalizations, and deaths in the continental United States, but that's where I want to stay. And one of the reasons why some counties are looking at additional restrictions, and we're underscoring the things that we can do to make sure that we don't continue to see spikes in cases are things that we all know and we've learned about in the last 4 months. And that's things like social distancing, and that's things like the hygiene, and it's things like wearing a mask to be protected. So there aren't any specific metrics. Look, even if we had half the number of cases that we've had, anytime I see new cases, it's concerning, but I hope that this is, because I'm not the only one talking about this, right? Yeah, business is talking about it. Billings, the mayor was speaking about it last night. In many of our major communities, it's not just folks in the government saying, we've got to take this more seriously because it's up to Montanans to make sure that we can keep this virus contained. Hi, Maritza.
Hi, Governor, and hi, Coach Choate, and also happy birthday to you, Holly. I have 2 questions, Governor. My first is, what's your message to Montanans who say wearing a mask is a violation of their civil liberties?
Look, this should never, the virus isn't political. Wearing a mask is being protective of those around you. And that's one where you've seen in red states and in blue states that being protective, not only, has there never been like a mask ordinance that's been struck down, but to encourage people to say, let's not make this about sort of political food fights. Let's make it about keeping our businesses open, making sure that we can watch football like we all enjoy in other sports. Let's make it about keeping our employees safe, keeping the most vulnerable among us safe. And we all living in a community, and this is we just on another call earlier today with the vice president and the coronavirus task force at the federal level. We are living under a public health emergency, not just in Montana, but across the nation. And we all have to take the personal responsibility to ensure that we're taking the steps to protect one another.
And my second question is, do you know anything about communication between our state and the home state of Kimberly Guilfoyle, who tested positive after she was at 2 separate campaign events here last week? And I know protocol says her state would get in touch with our health department to discuss possible close contacts, but I've yet to hear any of those contacts from those events are being investigated by health officials here.
I don't know anything about it. I mean, we can certainly look into it to the extent that it was a Montana contacts that were around, that I think the local public health would actually be doing the contact tracing, not wherever Ms. Guilfoyle's home state is.
Thank you, Governor.
Thank you, Maritza.
Governor, this is with KBZK.
How are you?
Doing well. Could mandating the use of face coverings or masks in public be a way of controlling the spread of COVID-19 within vulnerable communities like nursing home facilities or assisted living facilities? Is that something you would now consider?
Well, when it comes to our nursing homes, assisted living facilities, long-term care facilities, no, they should be masked up by all means. And there should also be testing along the way. And one of the things that we went 4 months where our legacy Montana's long-term care facilities weren't even allowed visitors. And there's not just, that certainly we did that because of these are some of our most vulnerable populations, but there are also the isolation and their emotional health considerations along the way. So in making it so that we could return to some visitors, it was also the expectation that CDC guidelines would be followed. And we put that out, and that includes the proper personal protective equipment for employees, and also it includes encouragement of masks as well. With the directive we'll put out tomorrow, that in order to continue visitation, there'll also be expectations of the testing of individuals that are actually working at these facilities, as well as some sentinel testing of the residents. Peter C. Probably Peter Christian.
Hello, Governor.
Peter, how are you?
Fine, sir. Quick question for you. The city of Missoula, the county of Missoula is about to, or they're going to consider on Thursday, enacting a mandatory masking ordinance through the Board of Health. I came in a little bit late on the beginning of your press conference. I don't know if you've addressed this already. Is that in the offing for the entire state of Montana to adopt that policy?
Look, I remain hopeful, certainly, that Montanans will take this seriously, especially as their patrons to businesses and want to see those businesses stay open. And I hope that we don't have to get to the point of a statewide mandate. But if we do, we also have to make sure that everyone's on board for it to be successful. There's some counties that are looking at that, and not just Missoula County, and I'm certainly supportive of that. But I'm also heartened to see that we have the coaches standing up. I'm heartened to see that more and more businesses are standing up, calling on Montanans to mask up. And I will be closely, as others will be closely monitoring sort of what's happening with the disease. I hope we don't get to the point of a mandatory mask order, but support any counties and communities that do so. And look, the stay-at-home order wasn't successful because of the statewide mandate and directive. What made it successful, and it wasn't, successful because people were out there enforcing it if you were out of your home. What made it successful was that Montanans knew that they individually and had the personal responsibility to take actions to protect not only themselves and their families, but those around us. And I mean, that's one thing that we as Montanans have always been really good at, is that we care about our community. So at the end of the day, I'm hopeful that, be it Missoula County or Gallatin County or any community, that the residents and the businesses will be doing this because we know that it's the right thing to do without regard to whether there's a public health directive.
I want to follow up on that because that strikes a chord with me. And I think it's one of the reasons why Coach Houck and myself have gotten behind this, is because I would think, I don't know what the core values are in the University of Montana football program, but I would guess somewhere in there, there's at least a reference to the word accountability. And I think that that's exactly what the governor's talking about here, is that there's a certain level of accountability that doing the right, we shouldn't have to tell people to do the right thing. You do the right thing because it's the right thing to do. And that's really what I'm hopeful for in us getting this message out to the citizens of Montana. I think about it like, we got a fire alarm here, Gov. Hey, the great ones adjust. Don't worry,
yeah,
we got this.
We can adjust.
And but at the end of the day, the things that we're going to do to help work our way through this, it's like mowing your lawn. You don't mow your lawn because the governor tells you have to mow your lawn. You mow your lawn because it's the right thing to do to keep property values where they need to be and take some pride in being a member of the community. This happens all the time. This is how we train our guys to.
Is that right? Keep them on their toes.
Yeah, we also have snow that falls off the roof. Sounds like an earthquake at times. Sometimes is that the Yellowstone super volcano?
Hi, Governor Bullock. Eleanor Guerrero calling from Carbon County News.
Hi, Eleanor.
Hi, just wanted to know if there's any likelihood of getting a better test with a better turnaround time, less false positives and negatives, and any increase possible for antibody testing. Thank you.
So, Eleanor, two things as far as the level of false positives and false negatives have been relatively small, but one of the things that's been concerning to me as we've ramped up our testing, you've also seen significant spikes in states around the country and in much worse positions than even Montana's been. So we've had contracted with a reference lab to do a lot of our sort of sentinel testing. And initially we were getting about a 2-day turnaround from when they got the test. And that's slipped. And I don't want somebody to be tested and we're waiting 8 to 10 days for a response and a result. So it's something that even literally today and tomorrow we're working on, trying to make sure and working with our federal partners, the CDC, to try to get so we can amp up more of that testing in Montana. And that's reagents for the machines, not the testing kits. And we'll be working on that because we can't have those delays, especially when we're doing some of the larger widespread community tests. As far as antibody testing, that when I look to sort of our long-term state plan, I'm starting to incorporate antibody testing, but it's not something that's widely accepted or available right now.
Hi, Governor. This is Iris Samuels from the Associated Press.
Hi, Iris.
You mentioned that some long-term care facilities declined sentinel testing when it was offered, including Canyon Creek. Can you provide any details on why those facilities declined to participate, and did those facilities have to pay for testing?
So to the latter, no, none of them had to pay for testing. We took care of the testing supplies and the materials. And I think that it's, in some respects, so the request is, and that's what will be required now if visitation is going to continue, is a one-time through testing of all of the residents, as well as all the staff, and then repeated testing of staff, and depending on the metrics, if there are any positives. And look, some of the concerns may well have been either disruption to residents or the challenges of getting staff all tested. But from my perspective, we need to be doing this because that's some of the most vulnerable populations. Nothing to worry about as far as. Okay.
Not a drill, but not
a Chris.
Hey, Governor Gordon. This is Chris Adlin with the Montana Free Press.
Governor Gordon's in Wyoming, Chris.
I'm sorry. I just moved.
Just don't call him out. Yeah. I mean, that would be 2 strikes.
Yeah. Oh man. Well, let's just forget that happened. Do you know how many cases now have been tied to a nursing home or assisted living facility? And then also, I mean, how many facilities we're talking about that have had cases tied to them?
Chris, I think we can get back to you on that. It's a small number, but I don't have the exact numbers.
All right. Well, thank you, Governor Bullock.
Yep.
All right. Sorry about that.
Marissa, will you check? Next question.
Hey, this is Holly again.
Just because it's your birthday, Holly.
I appreciate that. Thank you. So I'm asking a question about something I'm going to admit at the start I don't know very much about. So just give me a little leeway here, maybe.
We'll give that one to the coach then, okay?
I've been watching reporting about the R0 value and sort of the number of people that are infected by a person with COVID-19, and Montana is like second highest in the country on that. And I'm wondering if there's things about how the virus is spread in Montana that we can attribute to that, or if that's something that you're watching and concerned about.
That's Holly. Maybe we could arrange to either have Jim Murphy with epidemiology or Dr. Holzman give you a call.
Okay, awesome. Then maybe one other question, if I could sneak one in. What was the topic of discussion on the call with the vice president and other governors that you mentioned earlier? What sort of things were you guys discussing on that?
So this was, in some respects, an abbreviated call where there wasn't that much time for governors to weigh in. And I guess the speakers included the vice president, Secretary DeVos, because they wanted to speak some about, I think that the administration did something about the importance of opening up our K-12 system today at the White House. Some discussion with Admiral Giroir about testing supplies, but was a much shorter conversation than most of them have been. Is that it? Again, Coach, thank you for hosting us at MSU, but more than that, thanks for showing all of Montana sort of the importance of leadership and accountability as we work through this.
I appreciate that. The last thing I'd kind of add is just another, pep talk that I kind of gave our staff today about, personal discipline and how really one of our definitions that we use in our program of discipline is doing something difficult and challenging over in a long period of time to get a good result in the end. And I think that's really what we're asking. And I don't think it's that difficult and challenging to wear a mask, but we've all been through this roller coaster that we've been on, and now isn't the time to back off. Now is the time to grab a gear, put it in 4-wheel drive for us old people, lock our hubs in, and do what needs to be done. And this is a small sacrifice that we're asking you to make, and let's continue to have the discipline that we're known for in the state of Montana so that we can get that really good result in the end. And appreciate your leadership on this as well, Governor.
Thank you.
Perfect timing on the